Hi there and hi again. My name is Dr. Noor Hassan. I am a general practitioner, clinical nutritionist, and part of the amazing Chef Omar team. Today is the second episode about how to use nutrition as a medicine for treating diabetes. If you remember, to recap last session, we talked about magical potion to treat your diabetes. First content was eating pattern, and this time we will continue eating pattern as a part of our magical potion for nutrition in treating medical diabetes. To follow up, we talked about how to use carbohydrates, what carbohydrate choices, and how to maintain your carbohydrate count. So now we will talk about proteins. How to achieve protein as a pre-diabetic or diabetic patient. Make sure if you are not a vegan or vegetarian, you can choose meat, poultry, or fish. But make sure to use lean parts. Yes, lean parts, because they are less in saturated fats and they are more rich in MUFA and PUFA, which are the needed fats in diabetes, and they raise blood glucose level at a lower level than saturated fats. So as a general tip, use lean parts of this meat parts, meat, poultry, or fish. Second thing, try to take your protein more from plant sources. What do I mean by plant sources? There is a plant sources rich in protein. Just to try to make it 1/3 to 2/3. 1/3 from meat origin, 2/3 from plant steroids or plant proteins, because they are high also in PUFA and MUFA, and they are generally more healthy. Nutritionally speaking or food speaking terms, you can use nuts, you can use tofu, you can use hummus. Those are high in plant protein. If you want to know the source of high plant protein, please send us to ask or scroll down the videos. You might find one of my videos explaining what are plant protein. The last elements of the macronutrients for fats for diabetic patient or pre-diabetic patient. Please make it a general rule. Take as low fat as you can, but don't restrict fats. Fat restriction is not healthy, and not any medical or nutritional scientific terms is a healthy or good for your health. That's not a way of treating your diabetes or obesity or any nutritional problem. Just use healthy fats, low fats as possible. Don't restrict fats. How this can be translated in food terms: use fat that rich in PUFA and MUFA. What do I mean? I mean fish like sardine, mackerel, and others that rich in MUFA and PUFA and omega-3, which is needed for a diabetic patient and for dyslipidemic patient. What else I can choose? Use vegetables and fruits. Vegetables and fruits are rich also in polyunsaturated fatty acids and monounsaturated fatty acids. So make sure to choose a healthy type of fats, but don't prevent or restrict total restriction of fats. Also, please don't take fast food or junk food, because they are rich in the fat content. Almost like 70% are fat content. Please don't take fast food or junk food, because it will screw your diet, it will screw your weight glycemic control. One of the healthy eating patterns that we have to maintain in diabetes and other diabetes, to decrease fat intake from junk food and fast food as much as possible. And also depend on your cooking on baking, grilling, and boiling. Don't depend on frying, because frying with oils is very harmful to your health and your diabetic control or glycemic control, and we will talk thoroughly in other video. So to sum up, we talked about healthy eating pattern as the first element of our magical potion to control diabetes. We talked about carbohydrate and how to use low glycemic carbohydrates and how to maintain carbohydrate pattern. We talked about proteins and how to choose lean proteins and depend more of plant protein sources, like we said, hummus, lentils, and nuts and others. We talked about fats and how to use healthy fats, don't restrict fats, and how to decrease bad choices. Please keep following us for a better glycemic control, for a better diabetes control, to use nutrition and healthy way in medicine before depending on any medications, before getting to any insulin or any medication or any intervention. So please keep following us and stay tuned for our next episode. Thank you. Here's was Dr. Noor Hassan, clinical nutritionist, general practitioner, and part of Chef Omar team. Bye.